Hello, everyone. We're going to give people about 1 more minute to show up, and then we'll get started. All right, well, people can continue trickling in, and I'm going to get started with just a few announcements. First, this webinar is being recorded, and we are going to make the recording available afterwards. So keep an eye on your email, most likely next week, and feel free to share it with anyone who wasn't able to join. We are also keeping everyone muted for the webinar to avoid unintentional noises during the presentation. But if you do have questions at any time throughout, feel free to raise your hand. We can give you permission to unmute and you can ask questions. You're also welcome to put your questions in the chat at any time, and Julie and I can come off mute and ask Riley for you. We'll also have a Q&A at the end, so that will be another opportunity to ask some questions. So with that, we can go ahead and get started. Welcome to today's webinar, Injury Prevention Surveillance Data, What's Available and How to Use It, hosted by the Alaska Department of Health's Injury Prevention and Surveillance Unit. I'm Margot, and I'll be your host for the webinar. In the next hour, we'll explore some key data sources that can help inform injury prevention efforts across Alaska. We'll also look at some tips for navigating these sources, some real-world examples of how to use this data in everyday work, and we'll touch on how to request additional data or support as needed. So we'll have about 35 minutes for the presentation and about 15 or so for Q&A at the end. And now it's my pleasure to introduce our presenter for today, Riley Fitting. Riley is an epidemiologist with the Injury Prevention and Surveillance Unit.
Hi, everybody. I'll be your guide to this presentation. Bear with me for just a second. I'll switch up the presenter view and then get started. All right, how's that?
Looks good.
Okay. All right, so thank you, everybody. Thank you, Margot, for the introduction. Again, my name is Riley Fitting, and this is going to be a large overview of injury surveillance data. So injuries, just to set the ground level for what we're looking at, is going to be a broad topic right here. So this goes for everything from transportation accidents, like, if you get injured in a car crash, all the way to, playing sports in high school, maybe you have to things more expansive, psychological or mental injuries in the form of child abuse and neglect, to over-the-counter medication poisonings, etc. So injuries is a broad topic here. And with that, we have a lot to cover. I'll try to stay slow. If you have questions, feel free to ask, like Marco said. So let me get right into it by introducing the team that is the Injury and Prevention Surveillance, or the Injury Prevention and Surveillance Unit in the Division of Public Health. So we have it kind of split into two teams roughly. We have the injury prevention team and then the injury surveillance team. So on the prevention side, we have Teresa, Daniela, Daniel, Gail, and Carrie. And then on the surveillance side, there's myself, Jessica, Ashley, Chantel, Matt, and Anna. And what we try to do on the surveillance side, which I'm going to be talking mostly about, is how do we help our prevention team and non-DPH or external partners to try and reduce injuries across all of Alaska. So in this presentation, I'm going to try and cover three things. I'll stick to these three topics, right? So first one, let's talk about the injury data sources, being what does the injury surveillance team use to communicate data to our injury prevention team and other partners. The second thing I'll cover is data communication efforts, either by us, the injury surveillance team, or other teams at DOH that communicate injury data. And then the second is, what are some future plans for the injury surveillance team? So right off the bat, let me introduce kind of the way that we conceptualize injury data in the way that it's kind of shaped as a funnel in terms of how many Alaskans are captured and represented in these data. So at the top of the funnel, the widest data source we have are surveys. Our surveys will have general population estimates of who's incurring injuries or experiencing injuries, where those injuries are happening. It's really just a basic descriptive, description of our population of where and how these injuries are happening. Just underneath that rung of the data funnel would be emergency department visits, where sometimes someone might have an injury. It might not require hospitalization, but they'll still go to the ED, and they're not just going to do nothing about it. That's where we'll see, I think, the second most, the most widely captured data would be emergency department visits. Below that, if someone goes to the ED or if they're admitted into a hospital or other inpatient facility, we'll see that come up in hospitalization data. And then I think the most few or rarest injuries are the ones that are fatal, and that's the last step of that funnel would be our fatalities. So these data are all represented in these sources that we use. So this is a list of all of the sources for injury data that we'll use, and it's expansive. And the ones here in blue are the ones that we manage in the injury surveillance team. So I see a couple familiar names here. Maybe you represent one of these data sources, and for that, we're very thankful that we're able to have this partnership and we can use the data that you all collect to help injury prevention. But quickly looking at the data sources that we manage, starting on the left side with surveys, we manage the Overcoming ACEs with Resilience survey. And this is a survey that asks about adverse childhood experiences and protected childhood experiences to capture the psychological injuries or the injuries around child abuse and neglect. A second round of those data are just going to be ready soon, and those will be publicly available in a data communication effort I'll share later in this presentation. On the right side here are our administrative data sources, or more like our hard data sources, lower down in that funnel that I just shared, right? One of those data sources that we manage is the poison control line. This is a free resource for Alaskans. If they experience a poisoning or if they're around friends or family that is experiencing a poisoning, they can call this line and be walked through the medical system. It's a helpful tool and resource for Alaska, and those data are often used to inform injury prevention efforts. Maybe you've seen one of those prevention efforts in terms of it's summertime, people are going outside, they might experience, or might come into encounter with other plants that might be poisonous. They don't know that, they call the poison control line, they can get sorted out from there. Further down, in here are all these fatal data sources, right? I'm looking at the violent death reporting system and the state unintentional drug overdose reporting system, and further down. Those are all fatal databases that are managed in the injury surveillance team, and what those specifically cover later on. One of the goals from all of those data sources and that data funnel is that we can measure injuries across the life course, so that there's not one age group that we are missing or not reaching the needs of in terms of injury prevention. Through some of the connections that we have, we can look at birth certificates to identify injuries that might have been incurred at birth or were present among the mom. Later on, right across all their life, we have surveys that will measure injuries, and I'll go into those. Hospitalizations can occur at any life, and then at any stage of life, and then finally we have death certificates to inform the bottom of that funnel. So this is really the goal here, is that we can capture injuries, or we know which injuries are happening from a range of severity, being least severe to most severe, as well as across the entire life course of Alaskans. So we'll move into what exactly are the data that we're capturing and how we're using them here. So of all those data sources that I had in those lists, here are only a few of them that I'll go through them, but they're probably the most significant and the most that we use. So starting out with surveys, we have the Youth Risk Behavior Survey, the Behavioral Risk Factor Surveillance System. Those are CDC-based surveys that are managed in the Alaska Department of Health. And here are some of the exact questions that we'll use regularly to inform injury prevention. Most notably in these is that traumatic brain injuries and concussions are measured in these data. I don't think that it's unfamiliar, where a lot of head injuries are a significant cause of morbidity and mortality in Alaska. However, not every time someone experiences a head injury or a possible concussion do they go to the emergency department visit. That doesn't mean that those concussions don't have lasting impacts that we need to work on prevention with. We use these surveys to develop a lot of TBI prevention, or traumatic brain injury prevention. That last survey here, which is the ORS survey, right? This is the one that we manage in the injury surveillance team, along with some partners in women's, children's, family health, that collects information on adverse childhood experiences and protective childhood experiences. We'll go further down that funnel right now. We're talking about ED visits. The majority of the data that we use that is of ED visits is from the Syndromic Surveillance platform. This isn't a platform that's managed by us. This isn't a data source that's managed by us, but instead some partners in the section of epidemiology. And what this does is it gives us the real-time access to data on who is going to the emergency department visit for what and where, and then what are some of the outcomes for that. These are real-time data that allow us to quickly understand a health topic that's coming up. It's especially useful when we're looking at drug overdoses. It's very useful when we're talking about falls, in terms, if we have a really bad winter or more people falling on the ice. It's helpful for poisonings and season changes. The idea here is that we just have rapid access to real data, and we can form rapid responses. Further in that, we have the hospitalization data that we use. And I think I saw some people here from the section of health analytics and vital records that maintain this database, and we're able to use. So the biggest benefit to this is that these are hospitalizations for almost all health facilities in Alaska. And this is how we set our rates. So we can look at what are the most important injuries, what are the injuries that are leading to the most hospitalizations out there, right? Because we have that baseline number of, that denominator of all the hospitalizations that are happening, or roughly all of them that are happening. From this, right, we use it to look at rates, maybe what is the highest, the highest rate of all injuries that are happening, and we can target our prevention efforts from there. Another form of hospitalization data that we use quite often is from the Alaska Trauma Registry. This isn't one that's managed by us, but we use it a lot. And this is a very helpful data source that allows us to answer some specific questions. There are a lot of information in these data, especially with risk and protective factors. So we can answer the question of, there are a lot of bicycle injuries out there. How many of those bicycle riders were wearing helmets? This is the data source that we would use to answer that type of question. Moving into fatality data, which is really the bread and butter of the injury surveillance team. This is These are data sources that some of these data sources I'll share are ones that we manage and that are very useful for injury prevention. This one right here of just death certificates is not managed by us. It's managed again by the Health Analytics and Vital Records section. And just like their hospitalization data, this serves as this is the denominator for all rates that we'll put out for right, the amount of injuries per 10,000 deaths, amount of fatal injuries per 10,000 deaths. This is where we'll get those data, and they're incredibly helpful for setting the gold standard when we have our other surveillance systems. This is now moving into stuff that we manage in the injury surveillance team. This first one I want to talk about is the violent death reporting system. This is somewhat like the death certificates where we're talking about fatalities, but we're collecting more information than death certificates will provide here. The violent death reporting system is essentially a linkage between all of the information that's in death certificates and all of the information that is in the medical examiner's notes, hospital notes from hospital visits just prior to the fatality, law enforcement reports, at times news articles, really any of the information that we can get on this violent death. We'll read through it all, synthesize one record of that incident, and it can come to be around 800 variables. So 800 different circumstances that were present or not present in that fatal event. So somewhat like Alaska Trauma Registry, we can answer some very complicated questions into violence and death, which is especially important in Alaska and across the nation right now when looking at suicide and drug overdoses. Speaking of drug overdoses, a small section of the violent death reporting system, and just a little bit outside the violent death reporting system, is our state unintentional drug overdose reporting system that collects another hundreds of variables. That's why I have XXX, another hundreds of variables about drug overdoses, right? Using the same sort of data linkage process as the violent death reporting system. So we'll have death certificates and then match that up with what the medical examiner found and all the data that they used in their investigation. If we have law enforcement investigations for that drug, those data will also be included in here. So we can answer some complicated questions about these drug overdoses. Are there new substances being used? Are there substances being used in combination with others? Were there circumstantial details in that fatality too, like domestic violence or mental health problems, etc. There's really a key data source for us. The last three data sources that we'll manage here are the firearm injury reporting system. As firearm injuries are reportable conditions in Alaska, those reports come to us, and we maintain the firearm injury database, the occupational injury database, and the drowning surveillance system. And all of these data sources follow roughly that same format as the violent death reporting system and this unintentional drug overdose reporting system, where we're trying to link together a few data sets to have a comprehensive picture of what happened during that fatality. All right, so that was a lot of information on just the data that we use more or less on a daily or weekly basis. There are a lot of data sources out there that we don't use that I'm always interested in learning more about. So if you're out in the audience saying, oh, what about this data source? What about this data source? Chances are that we're aware of them and we're not using them, or it's a completely new thing to us and I would like to learn more and work on a partnership with you. So let's talk now about what our data communication efforts are. We kind of split this into two things. We have internal products and external products. This is often what I consider the most difficult part of an epidemiologist's job at the state, is turning out data to make it publicly accessible, since we're beholden to some strict privacy rules here. So what we can do internally is a little bit different than what we can do externally, right? I can transmit and, you know, relay some information to the internal partners that I cannot relay externally. So our communication efforts are different, essentially. So that means that they're built out in different ways. And that's what these icons are here, just kind of the ways that we'll try and get these information out. An example of one of those internal reports might just be a single page or a PDF that says what are the real-time reports of injuries, like what happened last week with overdoses, or what happened last week when it comes to falls in Alaska. Those are quick, they're fast, we can reproduce them easily, and it's just the basic descriptive epidemiology I'll have, so the who, what, when, where of the injuries. Right. Why is just a little bit more complicated. And here's a picture of what that report might look like. External reports, a little bit more varied, because, right, we have to get different products out there. Some people like scientific publications. Some people just want a single data point. So it really comes down to what does Alaska need? And how are they, how is Alaska going to take those data? So if you all have any ideas in the audience of, a specific report that might be helpful, we'd like to hear it because we want to get these data out. Some of the ways that these data are published by us or have been published by us in the past, or we will write an epi bulletin, which is essentially a scientific one-pager that gives an updated look at the epidemiology of a certain injury. Forward from that, a little bit less scientific, but more scientific than an infographic, might be what we'll call a special emphasis report. The last one we did was on traumatic brain injuries in partnership with the Health Analytics and Vital Records. It's somewhat like an infographic, but just a little bit more scientific. And the last part of it, something that we might do, just a single one-off publication would just be an infographic, right? That just has easily digestible data points for any program out there. Another external report that we either manage or will help construct or definitely guide people towards if they're looking for those data are dashboards, right? So these are either some R-Shiny dashboards or some Tableau dashboards that we can put out or manage. 3 dashboards that I use all the time are listed here: the YRBS dashboard, the BRFIS dashboard, and then those ORS data are represented in the dashboard that we manage, surveillance unit. If I have time at the end, I might take us to that last one where ORS data are, so you can see some of the data that we collect and how we use it in conjunction with other data sources. All of the other data, those administrative data sources that we use, most of them have their own dashboards. So I didn't want to link all of them individually, but there is one public health data hub that is maintained by the state of Alaska where all of these dashboards are located. But in specific, I'd like to call out these 4 dashboards, things that we use every day and that I've seen presented in other talks kind of just like this one. So that first one is the Alaska Death Dashboard that has all the death certificates. The second one, the Hospital Discharge Dashboard. Both of those are managed by the Health Analytics and Vital Records. They're fantastic tools to understand what are the top injuries out there. How are these injuries progressing over the years? Are we getting better on prevention? Are we staying the same, or are other things happening? The last 2 on there, the Alaska Opioid Dashboard and the Alaska Substance Use Dashboard. Both of those dashboards use data managed by the injury surveillance team. They use the other data that are not managed by us, but used together to tell the whole picture. Very helpful product. So let me move in now, how to request data, right? So say you went to one of those dashboards, you read through a report, you're still not looking, you're not finding what you're looking for. This is where you can ask for it through our survey link. So there's a link right here to our Survey Monkey, and this is a picture of it, right? So that line goes straight to us. That injury surveillance team that I showed before. We'll meet once a week. We'll talk about all the requests that came in. We'll send them out to all the people that can answer those questions best. If that's difficult, if things are, if your question is a little bit too intricate or complicated than what this Survey Monkey might have, you can always send us an email. So for general injuries, go ahead, email me. For the violent injuries, email Ashley, or for anything on drug overdoses, you can email Jessica. All right, so we have a lot of data sources going on. There's a lot of ways that we're trying to get them out. Now, what are our future plans, right? Our improvements to our surveillance is when looking back at that funnel, there's one thing that's missing, and some of you might be, aware that was missing. But what happens when an injury happens to someone, they walk it off, and they never have a contact with the healthcare system? They get captured in a survey, right? But what happens when someone gets injured and they go straight to the ED? They get captured in syndromic surveillance. But sometimes there's an injury that happens, an ambulance is called, the ambulance comes, get taken care of, but they never go to the emergency department visit, right? That's where emergency medical services data comes in. And we'd like to flesh out that funnel just a little bit more and have a better picture of what the injuries are happening at that level by including EMS data. I in theory too, that EMS data would help improve our fatality data as well if we can add EMS data into the medical examiner linkage with death certificates in law enforcement. We'd like to do that. Another planned improvement is to accelerate our abstraction process, right? Actually linking all of those data sources together, our fatal data sources, using some AI tools. If you have any interest in supporting that or helping out with that, or having any ideas, we'd like to know. A few ideas are in progress, and I can share the results from those if you feel free to contact me. We have a few data products too that are also planned. So please stay tuned for all of those internal reports of the real-time data that you might be interested on, like how many overdoses happened among this population last week or a month ago. Those are some of the data sources that we're hoping on putting out soon. This picture here is a snapshot on the future dashboard and still in a very rough draft. But the idea is that someone will just be able to click on the injury that they would like to prevent, or build programming to prevent, and it will give them the most recent emergency department data, saying this is where those injuries need help the most. In addition to that dashboard, we would like to have more, easily repeatable or just disseminated infographics from our violent death reporting system and state unintentional drug overdose reporting system that break down the data in a very digestible way to give those sound bites or those single data points so that people don't have to look through all the dashboards, but instead people can just see a quick infographic and share that as well. All right, I know that we're coming up just on an hour and a half, which will leave us some good time for question and answers. So to recap, the data sources that we use at the injury surveillance team, they cover the entire life course of Alaskans, and we try to cover injuries from a range of all the severities, from one that may not have been severe to one that ended in a fatality. Second is our communication efforts. They can occur between the epidemiologist and the prevention staff, trying to link our two teams in our injury prevention and surveillance unit together. But we also try to get those data out to the public in the ways of our reports or dashboards or one-off questions. Again, if you have any questions about injury data, feel free to shoot us an email or fill out that survey link. Lastly, the plans that we have, we would like to improve our surveillance using the emergency medical services data, and build out some AI tools that can help us speed up abstraction so we can have more up-to-date data when we need it. And to, in addition, just increase the amount of public infographics that we can put out. So I think, Margot, we can move into question and answer right now.
Perfect. Yeah, if anyone has questions, feel free to raise your hand or type them in the chat. I see that we do have one question right now, Riley.
Okay.
We're being asked, could you please share a link to the ATR data dictionary and or variable list? Is that something that you have a quick link for? If not, we can also include that in the email with all of the resources and the recording of the webinar.
I don't have a quick link for that, Marcia, and I know that the ATR is going through some transitions right now with their data software. I'll send you an email of who to ask for that, because I think that the variable list is going to be changing, essentially. My guess. I'll follow up with you, Marcia.
While others are thinking of other questions, I do have one here. Can the injury surveillance team provide analysis assistance with specific research questions? Like if someone's curious about where most homicides are occurring or overdoses, very specific questions. Are you able to help answer those types of inquiries?
Yeah, that's a good question. And the answer is it depends. If you have a specific public health question, or if you're trying to prevent a specific injury, like say in your neighborhood or in your village or your whatever area among whatever demographic, start a conversation with us. Sometimes it's not possible that we can disclose data at a very limited level of the Alaskan population, right? Because we're still beholden to the rules and responsibilities of data stewards from the state. But if you can start that conversation with us, then we can help answer that question maybe through a different way. We can say, well, here's the rate of injuries in this region, or here's the rate of injuries among this population, or here's how many injuries happened last year. So if you have a specific research question that you need to answer, or a specific surveillance question to try and guide your program, start a conversation with us and we'd like to help you out.
Thank you, Riley. Do we have any other questions right now? Julie did put in the chat, if you have questions that you'd like to ask offline, feel free to email Riley. We'll leave it open for a little longer.
And I can stop sharing too. It's easier to see people.
All right. Well, if we don't have any other questions, we can go ahead and wrap up a little bit early. I just want to thank you, Riley, for a wonderful presentation. And it looks like we might have a question coming in.
Looks like from Michael. Hi, Michael. Is there a fee for data requests for folks outside the state? No, we won't charge a fee for limited data sets, if that's what you're saying, that are coming from us. I can't speak to data sets that might be coming from the health analytics and vital records team, like death certificates or other hospitalizations. But if you're looking for a data set from the violent death reporting system or SUITRS, we won't charge a fee. That said, if you're not looking for a limited use data set and maybe just a data point, then also no. we'll try and get that data point however we can to you. And Julie, can I share a little bit of OR's dashboard? Yeah, sure. That's right. Yeah. All right, let me bring you all up again. Oh, thanks, Richard. I see you put in that the Havers information. All right, so this is the Alaska Childhood Experiences dashboard. URL is right up here. And it's in those slides, which, Margaret, can we share those slides too after this along with the recording so people have those links?
Yes, we'll make sure to link them as well as all the links that you mentioned throughout.
Okay, thank you. So once we get to this data resource center, in short, this has OR's data, that survey that we manage in the injury surveillance unit. It also has information from 4 other data sources, and it'll take you to an external data source that's managed by UAA. The idea of this is to provide a comprehensive look at child abuse and neglect injuries in the state of Alaska. You can look at those ORS data by going to one of the dashboards, our adult dashboard, either by clicking here or down below, you can click here. To start, you can read about what the data are. You can look at the main report that we had from them, as well as the survey questions that we asked. To look at specific topic questions, or like an ACE score or an individual adversity, you can use these drop-down methods to look at protections. You can use these. So just for example, if you wanted to look at the percentage of adults that experienced, X amount of ACEs, we'll click on that. This graph will load for you, and you can look at all of those data. Like I said, we were just finishing up a second round of data collection on this. So the first one was in 2023. We asked the same survey questions in 2025, so we'll have much better results that will allow people to stratify it by public health region still, gender, race, and then hopefully with all these extra results, we'll be able to look at more than just these 3 demographics, but we can broaden that number out a little bit, and it will be helpful. So this is for ORS data. On a map, we can map these responses. While it's loading. If this is going to take too long, you can also cross-tabulate the things, so we can look at ACE score by health outcome, for example, has problems sleeping, right? So this is what I think a lot of people would expect from a data dashboard. We can look at all the data from this survey that we manage. I'm a fan of the emergency department data. Those are also up here. So if we wanted to look at the amount of emergency department visits that come in for child abuse and neglect, we can look at it here. It's a rich data center. It has a lot of information. Julie, thanks for posting that link there. It can be very helpful if you're trying to form any prevention off of child abuse and neglect. I'll bring it back for any other questions that might be out there.
All right, well, not hearing any, please feel free again to reach out to Riley if you think of any in the future. And thank you all for joining us today. As a reminder, we will send out an email, so be on the lookout around next week for the recording of this webinar, and we'll make sure to include all of those links that we presented about. So we really appreciate your time and commitment to advancing injury prevention efforts in Alaska. Thank you all. Have a great rest of your day.
Thanks, everyone. Hope to hear from you.
Thank you.